An Austin hospital now monitoring a patient they say showed Ebola-like symptoms. Good evening, everybody. I'm Robert Maxwell. David Scott has tonight off. Staff at an Austin hospital say the chances one of their patients has Ebola is so slim, though, they're not even testing them. Still, a lot of us are on edge after a man visiting Dallas this week was diagnosed with the highly contagious virus. Seton Medical Center Austin rolled out a command center and put that local patient in isolation today. And KXAN's Kevin Schwaller's here now to show us what this says, Kevin, about safety protocols here in town.
Well, Robert, the fact just that we're hearing about this shows that those safety measures stopped someone from leaving the hospital. Now, if you remember, the hospital in Dallas originally sent that patient that is now tested positive for Ebola home. And this week, we told you about some of the procedures Seton put in place for Ebola. The situation today put those practices in play.
And now I've got a full barrier protection on the front, and then a mask with an eye shield.
This is one of the precautions Seton is taking if someone comes in with Ebola-like symptoms. In this case, Seton Medical Center Austin's chief operating officer says a patient came in from another healthcare facility early in the morning with symptoms that could be associated with Ebola. A statement from the COO says, in part, the patient had recently traveled in West Africa, but not in one of the affected countries. Based on the patient's history, lab results, and condition, state health officials determined the patient does not meet the risk profile for Ebola testing, and the patient remains in Seton's care so that it can rule out other viral diseases. The COO also says the patient is resting comfortably and in good condition.
The things that we would do to protect our community from Ebola are pretty much the same things that we already do to protect our community from influenza and any other viruses that might run through the community.
That's the ER director at UMC Brackenridge in an earlier interview about Seton's policies when someone is suspected of having Ebola. With the patient in Austin, the medical center put policies into action, including putting the patient in isolation, having officers monitor and control visitors to the patient's room, setting up an incident command center, and working with local, state, and federal officials. We mentioned that the patient did not meet what's called the risk profile for Ebola testing in this case. Digging deeper, we wanted to know what triggers a test. State Health Services uses a two-part criteria to recommend testing. Now, first, the patient has to have a fever higher than 101.5 degrees Fahrenheit and symptoms such as muscle pain, severe headache, or vomiting, among others. Many of those can be similar to flu symptoms. But to recommend testing, the person also has to have been in contact with bodily fluids or the body of a person with or suspected of having Ebola. Now, a person may also have lived or traveled to an area with active Ebola transmission, or the patient has to have handled certain animals from the areas with the disease. And with Part 2, doctors are specifically looking for that contact the last 3 weeks. That's the maximum incubation period for the virus. And again, in this case, state health officials say the patient did not meet this risk profile for Ebola testing. Kevin Schwaller, KXAN News.